I am Dr. Ramnik Parekh. I started my family practice in Mumbai, a very affluent area called Pedder Road, in 1963. I have worked for several medical organizations in the past. I was the president of General Practitioners Association of Greater Bombay. Then I was the president of Federation of Family Doctors of India, and currently I am the Honorary Secretary for South Asia region of World Organization of Family Doctors, which has a membership of more than 500,000 family doctors all over the world in 150 countries. Since I started my practice, family practice in India has gone through a lot of transformation. Gradually, people became more educated, customer became more demanding of family doctors, and there was a belief in general that general practitioner is an inferior doctor to specialists. Less and less medical students opted for general practice, mainly for economic reason, and also thinking that general practice or family practice does not give any dramatic results to get job satisfaction, which of course in my opinion is not true, but this is what has happened, and I think we have to look at why it has happened. Main reason is there are more and more seats available for post-graduation in medical colleges, and less people, less and less medical students get attracted to family practice. I think this is the reason, and if you want to stretch a little further, particularly in Mumbai and other big cities, the cost of real estate discourages a doctor to start his practice in the premises because they are very expensive. This kind of transformation has suddenly changed the healthcare scenario in society. People are educated and thinking that specialists are better doctors, and not realizing though that their specialty is narrowed down to only a few organs. However, they think they are better specialists, better doctors, and so they would directly go to the specialist. That is the impact. But unfortunately, a patient doesn't understand that if he has a hypertension problem, he can go to a cardiologist. He has diabetes problem, he can go to a diabetologist. But when he is just unwell, when he has just mild fever, sore throat, he doesn't know where to go. The patients unfortunately have also not understood that a specialist will not make a house call if there is an emergency at home. So these are some of the impact which has come on the healthcare in the society. Family physicians actually are the doctors of first contact. In a country like India, where the healthcare expenditure is shelled out from your pocket, 75% of healthcare spending in this country is out of pocket. And so, specialists are obviously more expensive than a family doctor. Family doctor also has the advantage that he knows your socio-economic status and does not prescribe exorbitant medicines or exorbitant tests. He knows your family members, your background, your past history, your family's past history, so he is at a great advantage to treat the family, patients in the family. So, in short, if I tell you that family doctor is easily accessible, most affordable, he gives continuity of service, and he is always available to you, not only as a doctor, but also as a philosopher and guide and a friend. Because of the rising cost of medical care all over the world, including WHO, including International Labour Organization, and all the healthcare societies in the world have suddenly focused on primary care and family medicine. For the same reasons which I described earlier, it is the most cost beneficial medical care, and it should form the foundation of the whole healthcare system, because it is the most cost effective and it is easily accessible even to the poorest people. So what we should do is government as well as the private medical societies should concentrate on developing more and more family physicians with general skills so that he is able to tackle any kind of health problem in the surroundings of the patient's home. So the need of the day is educate and encourage more and more primary healthcare physicians. Medical profession also is part of the society and it also shares the moral fabric of the society. So many times there will be a small sort of numbers of doctors, a minority of doctors may indulge into different kind of practice, but that should not deter anybody from contacting the general practitioner. In the whole world, family doctor is used as a gatekeeper of healthcare. He is the person who coordinates the healthcare of general public. And actually, he is also called gatekeeper because he makes healthcare more economical. And that's why it is better that doctors and patient develop a mutually trusting relationship. I think that is the need of the day.